In 1988, residents of the South Shore were excited when the doors of a new and modern hospital opened.
I think back to when this current hospital was built in 1988.
Yeah.
And I think about what the region looked like in 1988 versus what it looks like today. The population has grown, industry's changed. We're a different region now than we were back then.
South Shore Regional Hospital has been there to meet the healthcare needs of our region's growing community, from Hubbards to Shelburne, for over 30 years.
We cover a much bigger geographic area than you think we do when we start talking about that. And then we have to provide those services in a timely fashion. And the hospital was never designed to have that kind of flow of people, that volume of people through the front door every day. We were talking earlier about admitting being ready to handle
3,000 patients next year.
And an old video and it opened, and now we have 20,000 people in through our emergency department every year. We have probably 1,000 people every day through the front door for lab work and diagnostic imaging. So we need to update the flow of our hospital, and we need to update the services we can provide.
Our healthcare professionals have always provided top-notch healthcare to us. Now our hospital and our healthcare heroes need us.
We're expanding our physical footprint, but we're also adding new additions, such as our regional dialysis unit. Of course, we'll have an expanded new ER, and the new MRI, which everyone's excited about, means that people will not have to travel as far for healthcare. We're keeping services closer to home.
The plan? To grow South Shore Regional Hospital by nearly 30%, tripling the size of our current emergency department to incorporate 6 new exam rooms, provide functional new space for triage, and other critical health services.
Before, it was an outpatients department back in the 88, right? It was like, and now it's like we have emergencies coming in. We're, the only place that's open sometimes emergency-wise in the community. So there's not a lot of privacy for the people that are sitting in the hallways waiting for space to go into other rooms and stuff. And, our trauma room is right in the main section. So if we're trying to save lives, people in the hallway can still see us, being involved with somebody else's care. So the new trauma room is off and has like an ante-room and everything else, so it's all private.
By expanding the endoscopy and day surgery units to better support local patients needing a wide array of diagnostic and surgical procedures.
It's definitely crowded. Patients and family members are in tight quarters, and so staff are kind of having to navigate around the patients and their family members. Patients are nervous, surgery can be a very stressful time. There's a lot of unknowns, and you don't know what to expect if you've never had surgery before. So oftentimes patients want a family member there with them, so the redevelopment will allow for more space for that.
The redevelopment of South Shore Regional Hospital will also bring the region its first MRI scanner, its only SPECT-CT scanner, and a 12-bed renal dialysis unit. That's why the Health Services Foundation of the South Shore needs you. That's why we need brighter days.
A lot of people don't realize that with the regional hospital status comes a lot of services that other hospitals aren't able to provide. So this is a very important institution in our community. It's an anchor in our community, and we need to do everything that we can to support it.
I think the community would just want to be part of this campaign, to bring all this to the South Shore and to feel part of that, I think would be important to everybody.
We believe that people in the community should support the Brighter Days Capital campaign in whatever meaningful way that they feel like they're capable. Can we count you in?
Count me in for MRI access in our community.
Count me in for a larger, more efficient emergency department.
Count me in for access to dialysis treatment in Bridgewater.
Count me in for a bigger and better endoscopy unit at my regional hospital.
Count me in for new SPECT-CT technology.
Count me in for more day surgery space for me and my family.
Count me in for brighter days.